So you want to know more about surgery for stress urinary incontinence. You may know that a weak pelvic floor can make you leak a little pee when you cough, sneeze, laugh, or exercise. This is called stress urinary incontinence, or SUI for short. Your urethra is the tube that urine travels through. Imagine it like a garden hose. To keep you dry, your pelvic floor muscles act like a foot stepping on the hose to pinch it shut. If those muscles become weak, they can't press down hard enough to stop a leak. Think of it like a foot that isn't strong enough to cut off the water flow through the hose. Surgery helps pelvic muscles by adding strength to the urethra. This makes it easier for the urethra to stay closed, so you don't leak urine. There are many options for SUI surgery, each with pros and cons. One option uses the same sort of fillers as beauty treatments and is done right in the office. After numbing the urethra, your surgeon injects cushions of gel filler into the urethral wall. This is called urethral bulking because the filler bulks up the urethra to reduce urine leaks. Most patients are not cured, but this is the simplest option for SUI, with almost no complications. However, the filler can deflate over time and may need to be repeated for firmer pressure. Bladder infections and a hard time passing urine are rare, but possible after bulking. In the past, surgeons fixed leaks by using surgical sutures, a type of thread, to tighten the space around the urethra. Over time, sutures can stop working, so they're not commonly used anymore. You may have also heard of slings, or tapes, done in a hospital operating room. An anesthesiologist will make you comfortable during the placement of the sling. After surgery, you can go back home the same day and return to your usual activities 4 to 6 weeks later. One type of sling is called a tension-free vaginal tape, TVT, which is a narrow strip of surgical material called mesh. For TVT, your surgeon makes 2 tiny cuts in your lower belly to secure the mesh. Another is called an autologous fascia sling, AFS. Instead of using mesh, your surgeon makes one slightly larger cut in the lower belly and gets a small strip from your own fascia, the envelope around one of your abdominal muscles. In both cases, the sling is passed around your bladder through a small cut in the vagina. Both slings are great at treating leaks with cough or sneeze, but we still don't know for sure which lasts the longest. This is currently a big topic for medical researchers. Both TVT and AFS are like steel-toed boots, which can compress a garden hose and slow its flow. They need to be placed just right, so you can be dry and happy for years to come. Obtaining the strip of fascia through the cut in your lower belly makes AFS surgery 30 to 45 minutes longer than TVT. This may cause a little more blood loss, but not enough to be a problem. On the other hand, TVT can result in a unique complication called mesh exposure, where the synthetic material does not stay fully covered and pokes through the vaginal skin, causing discharge, bleeding, or pain. If this happens, a doctor has to remove the tiny poking fibers, either in the office or the operating room. Both TVT and AFS have rare risks of poking, scraping, or pinching nearby organs, such as the bladder, bowel, blood vessels, or nerves. More commonly, a stronger urethra may overwhelm your bladder for a short time after surgery. Your bladder could shut down and refuse to empty, or it can act up and give you urgent feelings or even leaking on the way to the bathroom. Sometimes this is caused by a bladder infection and may need testing and antibiotics. Your surgeon is there to guide your recovery and help you with any unusual symptoms you may have. So remember, surgery is the last resort for fixing SUI leaks. It's used when your own pelvic floor muscles aren't strong enough to squeeze the urethra shut on their own. There are several options here, and most will improve or cure your symptoms in the first few years after surgery. Talk to your surgeon about which option best fits your body and your lifestyle. For SUI treatment options that don't involve surgery, please check out our pelvic health exercise resources and other videos in our website library.